Okay, so now we're going to look at cupping for the hamstring and the ITB. Okay, so we've got the medial hamstrings here, okay, which make up semimembranosus, semitendinosus, and then if we come back out here, we've got the lateral, which is the biceps femoris. And if we come a little bit more lateral, then we're basically right on the iliotibial tract as well. Okay, so this is a really great area for cupping, and especially with a lot of the sporting injuries and so forth, and some of that hip protocol I've been talking to you about, you know, those medial hamstrings are an area where it gets really quite tight. So this cupping technique works an absolute treat. Okay, so as I said before, with all regions you need to test it. I've just done half a squeeze with this one. It seems like it's about the right tension, so I can move it back quite easily without too much of a heavy drag on it. So the sequence is, first I usually start with the medial hamstrings, so I'll come all the way down over here, and you're going to just drag down towards you just above the popliteal area, and then back up and then back over again. So it's sort of a rectangular type configuration in terms of the direction that you want to go. So down, across that popliteal area, and then back up, right up to the ischial tuberosity, back over again, and then down. Okay, so you're just working through all that medial hamstring fascia, back down. All right, I'll lose a little bit of suction. Okay, now if we come out, we're going to hit that lateral hamstring. You can see me rolling over that there. Okay, that's your biceps femoris. Okay, so now we're going to come up along the biceps femoris. Once again, all the way up to that ischial tuberosity, come back into the midline, and then back down again. All right, and then back out, and back up that biceps fem again, like so. Okay, similar sequence to the medial, except this time we're moving a little bit more lateral. So we will overlap the area that we did with a little bit of the medial. Now what we can also do is, with this biceps fem, just push down on the tissue itself, and then you can work across the tissue as well once you've freed up a lot of that longitudinal. Okay, so this is just another mobilizing technique that we can do, working along. Okay, we can come back into the medial as well, working that tissue across, and you start to feel it loosening off, and that will replicate that the cup itself starts to lose a little bit of grip. Okay, and that's what you want. Okay, so now we're going to come down laterally. Now we're going to hit that ITB. Now I tend to find the ITB loves to be cupped across. You can cup along. Sometimes it can be quite painful to do that, so I like to test the waters going across it first, and I think probably more efficient to come across the ITB itself, like so. Okay, like there. Okay, remember we're going to come all the way up, right above that, and into that greater trochanter area. We've got all that fascia that comes in and blends together. Okay, working down. So for those of you that treat and see a lot of the ITB conditions, this is absolutely perfect for it. Okay, and when we turn Tim over and we do the anterior thigh, we'll be hitting that sort of lateral fascia of the quadricep as well, which blends in here as well. Okay, so working down and back across.